What would you do if your newborn son suddenly went into shock? You would take him to the ER and discover that his body is losing blood internally. Then they take him to emergency surgery and they discover that his entire small bowel has died from lack of blood flow. Can he live without his small intestine? The answer is no. Can the small bowel be transplanted? That answer is yes, but it is a very risky wait, and the odds are definitely not in your favor. I recently read an article in Pediatric Transplantation about pediatric intestinal transplants by doctors and surgeons that are first in the field of intestinal transplant from the Children's Hospital in Pittsburgh. In the 1980s, specifically 1989, small bowel transplants first became successful. With the invention of tacrolimus, a new immunosuppressant drug, the chances for a person waiting on a small bowel transplant, their chances increase. My fascination about this topic and the conditions relating to intestinal failure have piqued my interest. Let me begin by describing what intestinal failure means and the conditions that lead to such a diagnosis. The doctors at Pittsburgh say that conditions that lead to intestinal failure are short gut syndrome and functional disorders of the small bowel. Short gut syndrome consists of the small bowel being too short or not functioning properly to absorb all the nutrients and minerals that the body needs to survive. Causes of short gut include congenital malformations, necrotizing enterocolitis, trauma, volvulus, gastroschisis, and intestinal atresia. Functional disorders also cause intestinal failure with motility issues. Those include pseudo-obstruction and intestinal aganglionosis or Hirschsprung's disease. Malabsorptive disorders also cause intestinal failure, along with tumors that are found in the small intestine. With the invention of TPN over 30 years ago, lives were extended similar to hemodialysis in patients with kidney failure. TPN, or total parenteral nutrition, is inserted through an IV and pumped directly to the heart, and it pumps vitamins, minerals, and fluids into the bloodstream. TPN complications arise because of IV access sites. Small children have a limited amount of these, and every site is crucial. Also, complication is catheter infections that cause sepsis in the blood from resistant bacteria, translocation of gut organisms into blood, and loss of immune gut function. TPN is a necessary evil, and it causes TPN-induced cholestatic liver disease, which then leads to liver failure and the patient also requiring a liver transplant. Without intestinal transplant, children with intestinal failure die at an alarming rate. 1 and 2 years with intestinal failure survival rate is only 49% and 40% respectively. A patient less than 1 year has an increased rate of dying from intestinal failure because they suffer from dramatic loss of their intestine and develop liver disease earlier than children with functional disorders. Determinants of survival with intestinal failure is the presence of jaundice or yellowing of the skin and eyes from the liver's inability to work properly, hypersplenism or enlargement of the spleen, and coagulopathy or the ability of the blood to clot, causing bleeding disorders. Some cases warrant the recommendation of other organs in addition to the small bowel and liver. Sometimes pancreas and spleen, stomach, and possibly the large intestine. OPTN, or the Organ Procurement Transplantation Network, says that 212 patients are waiting on a small bowel transplant or a combination of a small bowel, liver, or other organs. Some don't survive long enough to hear that organs have become available. 212 may not seem like a significant number whenever you consider the population as a whole, but that number is significant when your child is one of those numbers. My son was one of that child mentioned in the introduction. Once we set on our transplant journey, we discovered that there were many hurdles to cross, including many hospital stays, time away from family and friends, and much pain and suffering by my son. Now that I have relayed information that I have researched and lived through about small bowel transplant, I hope to have shed some light about the subject. However rare something is, we tend to think that these terrible things can't happen to us. We think that semi won't cross the center line and change our lives forever, and we think that a rare birth defect will never happen to our child. It is naive to believe that we live in a bubble and that terrible things don't happen to good people. We have to open our minds and embrace these situations when they're thrown at us, live one day at a time, and hope and pray for the best.